That's what I want.
Great. Well, if you're watching this video, then you have an interest in maybe picking up some tips or talking to people about drinking. Um, Especially if you work in a mental health treatment setting, or maybe people aren't coming to you specifically about their drinking, it can be tricky sometimes to bring up drinking in that context. Maybe somebody like that's not on the top of their mind. Maybe they're worried that if you bring it up, you're going to tell them to stop. It's not really what they want to hear. That may not be what they're coming for help with. Um, but you might notice a connection to what they're coming for help with and their drinking. So, what I hope to do today is give you some ideas about how to talk to people about drinking in ways that are not off-putting and just make drinking a thing that's talked about in, as part of mental health treatment. So I think a good brief exercise to get us all in the right mindset for this is to think about how drinking, changing drinking, and talking about changing drinking is similar to trying to change other health behaviors, right? So if you are watching this, uh, you probably work with people who you talk to a lot about change. If you're a human being in the world, you yourself have experienced how challenging and tough it can be to make a change. Um, and I like to begin with everybody putting themselves in the mindset of a health behavior change they themselves have tried to make. Um, it can be something that you're thinking about now, that you're sort of in the throes of. Maybe you're more at the beginning. So uh, the fact that you need to change something is just come to your attention, or maybe it's been on your mind, but sort of at the bottom of your to-do list for a while. Or maybe you've made a change in the past and that's you really stuck with that change, but can think back to the time before that change had been made. Um, so think about a change. It can be any health thing. We've all been there or are currently there now on any number of health related issues. And I think it's useful to think about your own experience of that change. What helped you be successful? Um, what did it take to get you to a point where you even tried to make the change, where you sort of geared up and then tried something new? And then what held you back? I think this is important context because as we talk about this, it's important to remember that the people we work with in the mental health treatment setting who we're talking to about their drinking are really no different, from us. Change is hard. We've all been there. I think if we can keep that in our heads, it will make us uh, better able to communicate in a compassionate way. So one of the things that makes conversations about change hard, in this case, in this video, we're talking about drinking, but really health change, is that not everybody is ready for change. So here is a moment to think back on your own change. Did you wake up one day and you were 100% ready and you just dove right in and made that change 100% and never looked back? Which does happen. But more often, we spend a lot of time thinking and wishing we didn't have to do it, wishing we didn't have to make a change, and sort of stuck in the middle, which in the behavior change world is called ambivalence. You see why you should make the change, but you know that it's not going to be easy and you stay stuck. And that's really very common. If I asked everybody who watched this video to make a comment on some behavior change and Do they have any ambivalence about a change? It would be, if we're all being honest, 100%. But when you enter conversations in the mental health setting around drinking, it is important to note that this is natural. It's not a sign that somebody's mentally ill or that they're a bad person or that they're not smart. We're all doing things that we should change all the time, and it's because change is hard. So ambivalence is a natural human response when faced with a difficult decision. It seems like there would be a way to break through ambivalence. Like if you keep telling people, you need to do it, you need to do it, what you're doing is really bad for you, look at all the ways it's hurt you, that would make a person change. Here again, I invite you to think back to your own health behavior that you have worked on changing. I'm willing to bet that the more people told you what you should do, the less you found that helpful. So on this slide, you see a list of things that we all do when faced with somebody else's change, and yet there's good reason and evidence to suggest that those are not the things that help. Trying to convince or persuade. Now, the words listed here sound negative: confront or argue or debate. They're not necessarily, you can do those things and not mean them in a bad way. You care, so you're trying to educate someone or let them know what you're seeing or that you think they need to know in order to make this change. So while those are, those words are pretty negative, they often, we don't think of them in that way. You're trying to persuade or convince, or you're, confronting someone. Look, you need to see this. You need to see it my way. And believe me, if that worked, I would tell you right now, and that's what we would do. But what we know is that the other list are the things that actually help people think about and eventually commit to making a change. It doesn't seem right that telling people to do it is not what makes them do it, but listening to them and what they're nervous about or worried about or why, all their reasons why they're really scared about this change. Showing empathy by saying, that is really hard. It feels like it's condoning staying the same, but it's really not. It's actually making people feel comfortable, considering that they could be doing something a different way. Offering support. How can I help you? We come from a culture where everybody's supposed to do it on their own. It doesn't matter. You're seen as weak if you can't do it. But there are lots of things we all need help with. And for many people you talk to, reducing or stopping drinking may be something somebody needs help with, but it's so ingrained that, well, if I ask for help, I'm weak or I'm stupid or I'm morally bankrupt or whatever. So those are the things we actually do want to do. And what we know is that the things on the do list keep people talking. They keep people engaged. They show that you care. And it leads to the next conversation, which leads to the next conversation. So the idea that one conversation will turn somebody to not drink again, that's probably pretty overly optimistic. But if one conversation led a person to say, wow, that wasn't terrible. That person really tried to understand me. Or that person didn't make me feel terrible about myself. Then they come back a next time. They might say, okay, maybe I could talk a little bit about this because they're not going to make me feel terrible. And so on and so on. Until somebody inches closer and closer to trying something new, to making a small change. So I'm really a proponent of communicating in a way that gets you more chances in the future. So the skills that I have listed here are all part of motivational interviewing. So in motivational interviewing, we're helping people find their own reasons for change rather than telling them our reasons for their change. We come to this, we mental health treatment providers, we are ready every day for the people we work with to change. We are 100% ready all the time for other people's change. The problem, like on that last slide, is that not everybody meets us. They're not ready yet, right? So here we are ready for them to change, and they're not quite ready yet. And that can create a real disconnect. That's, in my opinion, a large part of why a lot of people come to the mental health intake appointment. Maybe they make it back for one more appointment, and then we never see them again. It's because we're already in the action stage and they are not. And they feel that. They feel like they're going to be pressured or told what to do. And that is really not the way anybody makes progress. So in motivational interviewing, it's using a list of skills to get people talking, and then you're using the skills to highlight different things that they say, different ways that they're thinking. And over time, that leads them to open up more to change. So if you have the opportunity to go to an official motivational interviewing training, if you haven't been already, and you have an opportunity to go to one, grab it. Sometimes they could be a couple days long, but there's a lot to learn. And the trainings are built around learning and practice. And so you come out really having tried out the skills. So this video is not that. I have selected a couple of motivational interviewing skills that I think are very helpful when you're starting to talk with people about their drinking in the mental health treatment setting. And they have the benefit of being skills that all of you watching this video use all the time. You may not use them when it comes to talking about someone's drinking, but you already know how to do these things. So that's why I've selected them, because they come naturally to you anyway. You're already using them. I hope to get you thinking about how to use them when you're talking about someone's drinking. So we're going to start off talking about reflections and summaries. Reflections are statements that you've heard a person. Remember on the communication slide, the do is listening on the do list. And so reflections show that you're listening. They're just statements you repeat you can repeat somebody's words back in a simple reflection that's either the same words or a paraphrase. Or you can make it more complex, where you're sort of guessing at what they mean, even though they haven't said it. And most of the time you're going to guess right, and some of the time you're going to guess wrong. That's okay. They'll correct you. There's also reflections where you can reflect back the underlying feeling. And that can be very powerful because, lots of people are hiding their feelings or not talking about their feelings. And we live in a very fast-paced world and nobody's really paying attention to anybody's feelings. And so to respond that with the right feeling word can be very powerful. A summary is just a bunch of reflections gathered together, right? So summaries are particularly good when you want to scooch the conversation in a slightly new direction, or there's just been a lot of talking going on. You've spent a lot of time reflecting and listening, and you just want to make sure you've got it. You can summarize. You reflect several things that have been said. Open questions, as you know, are questions that don't have a yes/no answer. And so they're inviting people to give you more detail. Now, that's not that closed questions don't have a place in what we do. They certainly do. They're especially useful when people do not feel comfortable and are not talking a lot. closing up your questions and not asking them to give you details that they don't want to give you is, a good match for where somebody's at. If somebody's really uncomfortable and not talking a lot, maybe a little balance between closed and open would be good. But generally speaking, open questions invite a person to give you more information and more details that then you can reflect back. Sometimes you do want to educate or share information with someone, and that's okay. The way to do that from a motivational interviewing standpoint is with a skill called elicit, share, elicit. It's when you ask a person what they already know about something. There's nothing more annoying than somebody telling you what you already know. It communicates that how do you feel when somebody explains something to you that you don't need explained to you? So if you elicit what somebody already knows, you're overcoming that issue. You're not giving them information that they already have. So what do you know about, fill in the blank? An example might be if I'm talking with somebody about medicines for alcohol use disorder. I might say, I want to tell you a little bit. You may not know that there are these medicines out there that can really help people who are trying to cut down on their drinking. What do you know about medicines that can help people cut down on their drinking? And you listen to it. They may know an awful lot. It should be great. And you can reflect that back. Or they may know nothing. But whatever they know, you don't have to repeat it. So then you can say, well, you really know a lot. Or it sounds like you've never really heard about these medicines before. Would it be okay if I give you more information about them? Everybody's going to say yes. If somebody says no, they don't want to hear it, then that's great. Don't tell them. But most people will say sure, or okay, or I guess, something affirmative. And then you can provide the information. Well, actually, there are a couple of medicines that really help people cut down on their drinking. You can actually take them. They're prescription medicines, so a prescriber has to, monitor them and talk with you about them. But, our prescribers, your psychiatrist here can tell you more about it and can prescribe it and, talk with you periodically about it. And the good thing is, it sort of works like you've heard about those new weight loss drugs that you just take and they really, they help, you don't have to stop eating in order to take the weight loss drug. You take the weight loss drug and it helps you manage your eating. This is the same sort of thing. Instead of you have to stop drinking to take a medicine, you take the medicine and it helps you stop drinking. So that's the share. And then the second elicit is asking, well, what do you think about that? So I might say, I'm guessing some of that was new to you, some of that information I just shared. What do you think of all that? So now you've given information or you've educated in a way that's not critical or it's supposed to be very neutral. Okay, let me tell you about this. And that way people don't feel judged. They're just being given the nuts and bolts. And then finally, affirmations are statements recognizing a person's strengths. They're more than, a reinforcement, which is you did that well or, good job. Those are important too, don't get me wrong. But an affirmation is seeing something in somebody. Sometimes they don't see it in themselves, or they haven't thought about it in a long time, or nobody's ever pointed it out to them. So I have some listed here. These can be particularly important when people are really at a low point because all they're thinking is that they've really messed up. They're really bad people. They're not bad people. They're people who are in a bad situation that they're just trying to figure out. So hearing that you have a lot of strength or you're showing a lot of determination in the face of setbacks, those are you're pulling something out about a person's character and you're saying, I see it, even though things aren't going the way you want it right now. So on the next slides, which you have access to, are all sorts of examples of what these skills sound like and look like. And I'm not going to go through all of them because you can look at your own pace. But the goal here is if any of this is new for you, either across the board or when you're talking about drinking, it can sometimes be hard. Like it's easy for me to say, yeah, use a reflection. But if you don't know what that sounds like, it can be hard to pull it. So this way is a way that I found. Give people examples. Let them digest those examples. I would then encourage you to come up with your own examples based on what you've heard. Think about a person you've worked with. What have they said about their drinking? Write that down and come up with some reflections. So here's an example of just reflections and summaries. So I've started with a little blurb, a little vignette. The person we're working with is saying, I know that drinking is bad for my health. Of course I know that, but I have lots of stress in my life. Drinking is the only thing that helps me feel calm when I'm stressed. Now, most of us listening to this want to say, but you can learn new ways to cope with stress. And while that is true, that's a very action stage statement. And if somebody is not in the action stage, it can be something that they are not ready to think about, not ready to hear. So that's not a reflection. A reflection, or a bunch of them, some examples are listed here. Drinking helps you feel calm when you're stressed. That shows that you heard them. You didn't just disregard and say, oh, but you'll just cope in a different way. So that's a simple reflection, just repeating the words back. A simple reflection, paraphrasing the words might be, you know drinking is unhealthy, but you're not sure how to cope with stress without it. The double-sided reflection is a hallmark of reflecting and motivational interviewing, and it outlines the ambivalence. On the one hand, it's hard to deal with the stress in your life without drinking. On the other hand, you know that drinking is bad for your health. So you're putting it out there. Sort of the push and then the pullback. I think if I were to add a reflection that got at the feeling, I might say something like, it can be exhausting trying to figure this out. Or you're tired of hearing this and not having good solutions. Something that get a feeling word in there. And then you see the summary. To sum up, you know a lot about the health effects of drinking, and what you know is getting you to think it might be time to cut down. But you get stuck when you think about how drinking helps you cope with stress. You can't imagine another way to cope that would be as successful for you. So here's another example of reflections and summaries. And really I should, so I have them all in red because back on this slide, I put them in red. So I'm drinking and I'm okay with it. So this is our pre-contemplation person who is not thinking about change yet. Imagine you open with, well, you really need to change. It's bad for your health. That's going to be a non-starter. It could be even a relationship ender because that person is now, they're not listening to me. So our clinician in this situation says, drinking makes you feel good. Or I might have said, you like drinking. You're okay with your drinking. It's probably what I hear now, thinking about it. And our person says, yes, I drink socially. Everyone does. It's fun and relaxing. And our clinician, instead of saying, well, but other people can drink safely and maybe you can't, and think about all the ways that drinking is ruining your life, our clinician is reflecting. Your drinking seems the same as everyone else's. And our person says, right, I've never been told I need to do anything differently. Now that I'm on this medication, I'm all of a sudden not supposed to drink. Like one day it's okay, and the next day it's terrible. And our clinician reflects again. Instead of saying, well, you'll get used to it, the clinician says, it's sudden. It's a sudden change. And our person says, it's too sudden. This medicine is going to be a huge change in my life. And then our clinician sums it up. You drink when you're out with friends. You feel like your drinking is pretty much the same as everybody else's. It makes you feel relaxed. But you're taking this medication and it's hard to think about not drinking when you're out with your friends. Don't look at that last open question. We'll come back to that. So here's another example, drinking with friends. It's what we do. You can see how the reflections land here. So maybe you're saying, well, Melanie, if this is so, like what you said, I already know how to do this. And I do, I reflect all the time. And that's true, but sometimes we get caught up because we really, like with drinking, we really want the person, we see it, we see that this person is really being harmed, really want them to change. And so some of the roadblocks get in our way. And the red ones are ones that I find myself falling into a lot. So I jump to providing solutions. I believe 100% that anybody listening to this suffers from that same thing. We're just ready. We're ready to solve a problem. Some of these sound very negative, and it's not that, again, here's another example. It's not that I have meant anything by telling people what they should do, or I probably wasn't trying to shame. I mean, I hope I wasn't trying to shame or ridicule anybody. But it's a good reminder of what we say is not always what somebody else hears, right? And so I may be saying it, and in my head I'm going, 3 cheers for you, Melanie. You've really said this in a kind and thoughtful way. And the person hearing it is like, that's terrible. She just said that I'm bad. And it's that disconnect that causes problems. So reflecting what you've heard is always a good, it fits in every situation. Okay, so let's go back to this. So you have now some examples of reflections and summaries. I would encourage you to do the exercise I mentioned. You know, today, write down a couple of statements that you heard in your practice and just come up with some reflections. So I want to move on to open questions. And I use this slide all the time. I refer to it. This is just a list of open questions. These are ones that I use all the time. You don't have to have a new open question for every situation. You can have a few that you like. When I'm talking to people, so these aren't, they're not only drinking, but you can put drinking instead of smoking or whatever. The ones that I find I use the most are third from the bottom. What are the good things? What are the less good things? That's your classic pros and cons. So I like hearing what people like about their drinking, because that's, you know, that's what keeps them in that behavior. So I think it's important to hear it and not then say, oh, but that's not such a big deal. Like if people use it for stress reduction and they like to relax and they go out with friends and it's social and it's fun and I would write those on a list without trying to downplay them. Those are the spoiler alert, those are the reasons people drink. It's fun and it's social, it's relaxing, helps you feel less stress. The same way, I would say, okay, so like anything we do that feels fun and good and relaxing and helps us cope with stress, there's probably some downsides. Those tend to differ by person. What are some of the downsides of drinking for you? And then they're going to say, whatever they say, you can reflect. Even if it's not, you might be looking at a person and going, oh, there's like 1,000 downsides. And they may start with something that wasn't on your list. They might say, well, sometimes it makes me tired. Okay, tell me more about that. That's your reflection. I mean, an open question. Tell me more about that. In my world is also an open question, even though it doesn't sound like a question. It's inviting people to say more. I also like, how would you like things to be different is good, especially when somebody is really at a low point in their lives. It's hard to think about change, but it's maybe a little easier to speculate, to kind of look to the future. Here's how I envisioned I would like things to be or like things to go. About midway through, why are your whoever, family, spouse, or doctors concerned about you is a good one for when you're talking with a person who sees no downsides, but you know that people are talking to them about this. Or maybe they've come to you about mental health and substance use things, but they're not, they're in the pre-contemplation stage when it comes to their drinking. I'd say, well, when in your view, your drinking is, par for the course, like it is with other people. You did mention that your wife had some, things she was concerned about. So tell me a little bit about that. Why is your wife concerned about your drinking? What does she tell you? And even though the answer to that may not be, the person may not endorse it, they're still saying it. So, well, she worries too much. She worries all the time. She thinks that, I'm out with friends and I'm going to drive home and I'm going to get killed. And, that's silly. I know how to drive. There's a lot you can reflect there. So the tone is not, oh, I agree. The tone is, they shouldn't be worrying about that. But not only are you now learning something, but you have something to reflect back. So your wife is concerned that when you drive home, that, you could get in an accident or be pulled over because you've been drinking. You're not as concerned by that. That would be my reflection. Even just in a tone, you can convey something like, you're, though, not as concerned by that. And then it's kind of a question, but it's a statement. And I would expect the answer to be, well, of course not. I know how to drive. I'm actually a better driver when I've had a few to drink. Anyway, so you're learning more. You have things that you get, and now you're going to have to fight against that impulse to say, well, that's wrong. You're not a better driver. Nobody's a better driver. You may at some point want to correct that information using elicit, share, elicit. But at the beginning, I think you want to reflect. So I like that one for that purpose. I also like what worries you about your drinking. So especially good when somebody says, well, my doctor keeps telling me my diabetes is bad and I have to drink less. I'm drinking too much. I talk about that a little bit. My doctor said, what does your doctor say? How is it? But then I would probably get to a point, okay, so your doctor's worried about how drinking impacts your diabetes. And so you're taking that seriously and thinking a lot about it. What worries do you have about your drinking? So aside from your doctor's worry, that's how that might sound. So those are some examples. And so here are a nice opportunity for an open question is after a summary. So you're talking with someone, reflecting, they're answering, reflecting, they're answering. You want to do that a bunch of times with reflections. And then you summarize, and maybe you want to move in a little bit of a different direction. An open question is a good way to do that. So here's our summary from the earlier page, the earlier slide. You know a lot about the health effects of, this was smoking, but, insert drinking. Makes you think about trying to quit. You get stuck when you think about how smoking helps you cope with stress. You can't imagine another way to cope that will be as successful for you as smoke. And here are some open questions, which could be just as simple as, well, we've spoken a lot here. What do you think a good next step would be? I might add in an affirmation. I might say, you're really coming at this thoughtfully. You're really engaging pretty deeply, thinking a lot about it. I do a lot of things with people. I help them do this, or I refer them for that, or what do you think a good next step would be? And this is another, it says, it's more of a you theme. Your parents tell you to make new friends, but it's just getting at, here's the summary, and here are some open questions you could pair with it. The next couple, I have a couple of slides that do this and kind of give you a full conversation. You can see here in red, we've got reflections. In blue, we've got our open questions. I've scooched ahead and put in some elicit, share, elicit moments. And then in purple, we have our affirmation. So let's go through this one, but then you'll have more that you can review. So here's our person. I'm worried about my health. My doctors told me to cut down on my drinking. My first reaction to that would always be, oh my gosh, that's so great. Let's get started. Like, that's a great decision. But it's always good to start with reflecting, because you might find that that person is not on the same page with change. So our clinician knows this and says, you're worried. What's worrying you? This is terrific. Less words, the better in my book. And our person says, my blood pressure is high. My liver is showing some problems. My doctor said it's from drinking. And instead of educating or whatever, our clinician just reflects. So recent high blood pressure and liver problems have caused you to wonder if now is the time to quit. Now that's a little tricky, right? Well, tricky reflection, because they didn't say anything about quitting. But that's a little more of a complex reflection where you're adding something in that the person didn't say. You're kind of floating it out there. They could come back and say, who said anything about quitting? That's fine. And you can pull back a little bit. This person, though, didn't. Well, I know drinking isn't good for me, and it isn't the first time I've heard that I need to stop. Ah, that's a great thing for our clinician to know. And with a reflection. So this has been on your mind for quitting. Now we're talking about quitting and stopping. Quitting drinking has been on your mind for a while. What's been holding you back? So you can go on and see the rest of it, but you can see how far this conversation gets with reflections and open questions for the most part. So this is just another example. I want to spend a moment talking about the whole point of these skills and really, and using them in ways that pull out what motivational interviewing calls change talk. Statements that favor change, and so you're elevating those, you're pulling them out, you're putting them front and center, versus sustained talk, statements that keep people doing the same thing. And so we make a distinction between two types of change talk, darn and cat. The darn statements are things like, the acronym stands for desire, reasons, desire statements, ability statements, reasons statements, and need statements. So they communicate change, but cat statements communicate making a change, right? Doing something. So we like all statements. We're really trying to lead people towards cat statements from darn to cat. So that's from thinking about change, identifying the need for change, to actually doing something that is changed. So you're using those skills to highlight change talk and to sort of dis-highlight sustained talk, spend less time on it. So the problem or the trick is that when people are ambivalent, they're all mushed together, right? The change talk and the sustained talk are mushed together. So you can see that here. I need to do something about my smoking. That's change talk. But I've tried quitting and it never lasts. That's sustained talk. I mean, I know I need to quit because of my health. Change talk. But it just helps me deal with things. That's sustained talk. So you want to be using your skills to highlight the change talk and downplay the sustained talk. So a reflection I might make for this statement could be something like, while you haven't quit for good in the past, you're starting to think that the time is right now to really give it a full court press. Maybe that's overstating a little bit. Somebody might go, no, that's not what I said. That's true. I could say maybe, I probably would just say, even though you've tried in the past and it hasn't really, gone 100% your way, you're kind of coming to it renewed now because now your health is really impacting your thinking. I better, I got to get out in front of this. So it's time to try again. You don't want to ignore the sustained talk necessarily because you're trying to show that you're hearing somebody. If you ignore half of what they're saying in a couple of statements, it's going to feel fake, like you haven't heard. But you don't have to spend as much time on it as you do on the change talk. So I might say, you've tried a few times, but now that it's impacting your health, you're really coming at it from the, okay, I'm gonna sink all I've got into it. And then I might use one of my open questions. So what do you think? What's different about it this time that makes it really important for you to figure it out now? Right? And then that's change talk, whatever the answer is. Well, now my heart's really bad and I'm on this new heart medication and I've actually, worried that I'm at the age that my dad was when he had a heart attack. And I really don't want that. Or, my kids just left the house and I've got all these good plans or whatever. But those are all reasons, change talk. Right? So you're pulling for the change talk. This is just more examples. I'll leave that to you to take a look at. Before we wrap up, I want to tell you about two exercises you can do with people that give you the perfect opportunity to use these skills to highlight change talk. So one is called the decisional balance exercise, and it's basically an expanded pros cons list where you're asking people what's good about a behavior, that's sustained talk, and what's bad about it, that's change talk. And then you're adding in the pros and cons of changing that behavior. So imagine you did decide to stop smoking or stop drinking. What would be hard or get in the way? That's sustained talk. And then box 4, if you did stop smoking or insert drinking here, what would that be like? What would the benefits be? That's change talk. So boxes 2 and 4 are change talk. Boxes 1 and 3 are sustained talk. And you use all the reflecting and summarizing. A trick, you spend less time and effort on 1 and 3. You get them out. You want to know the sustained talk. You want it out there. But I tend to, I write some notes. They fill up the box. Maybe they don't even fill up the box so much. But in 2 and 4, I'm really asking a lot of questions. I'm writing tons of notes. I'm going into the margin. I'm reflecting and summarizing. I'm asking for more examples. And that gives you a visual at the end where boxes 1 and 3 when I sum up. So let me sum up. There are some good things about drinking. You like it because it's social and it helps you cope with stress and relax. And you feel like it would be hard to give that up. If you were going to cut down or quit, not having drinking as much present in your life would be hard. You wouldn't know how to cope with stress. But you thoughtfully have listed a bunch of things that drinking is sort of doing that are not serving you well. You've noticed you're drinking more even when you're not in social situations. You've noticed this, you've talked about this. Your relationship is kind of suffering a little bit. Your wife is really concerned to the point where she is really hoping to see some sort of change. So I'm really talking about this and I'm really summarizing this. Fortunately, were you to make a change, you see a lot of benefits associated with that. Health-wise, relationship-wise, So you're writing less in 1 and 3 and you're talking less about 1 and 3. And you're writing more in 2 and 4 and you're talking more about 2. And you end the decisional balance by saying, it's not rocket science. They get what you're doing. Like a person will get it. We would get it if we were on the receiving end of it. But I usually end with something like bringing that up. Okay, so you see what we're doing here, right? Yes. What do you think of this? And a lot of times the answer is I've never really thought about it this way. It's never been all on one piece of paper before. I go, okay, next time we talk, I'd be eager to hear from you some reactions, like what this was like for you and what you take from it. And then I have an example. Thought I had an example. I may later on. of what this looks like in a conversation. The final exercise is called the readiness ruler. How ready are you right now to reduce or stop drinking? And it's said the same way every time on a scale of 1 to 10, with 1 being the lowest and 10 being the highest. How ready are you right now to, it can be reduce or stop. It could be how confident are you? How important to you? And again, I have a smoking example, but you can just substitute drinking. So how ready are you right now to change your drinking? Whatever they say, your next question is, why did you select that number and not something lower? Whatever they say is changed on. So suppose they say, well, I'm not really very ready to make a change. I'd say a 4. Okay, a 4 on a 1 to 10 scale. Why did you pick a 4 and not say a 1 or a 2? Well, I know that I have some that I hear in the news all the time that there's no amount of drinking that's good. They used to think it's good, but now any amount of drinking is really bad. And my doctor has told me about this a couple times. Okay. Right. I remember you mentioning your doctor was connecting your drinking with your high blood pressure. Tell me about that. Like, what was the connection there? And they start talking about it. That's changed. Somebody might say, I know I'm not getting any younger. And I know that at some point I'm going to have to get my, weight in check. And I know that drinking is not helping that. Can you tell me a little bit about that? Why now? Like, what does it have getting older in your head? Like, how is that connected to your weight and your drinking? So, well, that's changed. And then you ask, okay, so what would it take? So you're at a 4. What would it take for you to select a number that's a bit higher, maybe a 6 or a 7? But all that's change talk. Now, if somebody says, how ready are you right now to change? And they pick a 1, not at all, that's okay. Say, okay, so I hear you loud and clear. You are not ready at all. You have no reason to make any change right now. And then I skip and I go, well, what would it take for you to select a number that's a bit higher? A 4 or 5, like bringing this whole topic a little bit, more, up the scale of things that you're thinking about. And whatever they say. And, have I had people say, it's never going to be on the top of my to-do list. It's just not something I even think about. Sure, and then I use reflections and summaries and, I move on, but I've tried. And then I know it for my own. The readiness ruler is, this person is not ready. Okay, so you'll see some examples. Again, color-coded. I threw in this one an affirmation. I have also some slides here. I'm going to keep them. They're all on different topics, but they're all it's all about health behavior change. And you can just see how reflections and open questions and summaries look. And the language is all the same, whether it's something about eating differently or drinking or smoking or drug use or exercise or any of those. Here's another one about drinking, and then I have it formatted a little different, but just some examples of reflections and summaries and all the other skills. So maybe I'll close with whether these are brand new to you or these are skills you use all the time. You're ready. You're ready to try them out in response to, in the context of talking with people about their drinking. And I have no problem if people start small. So the next time a person who is drinking comes in, use one reflection. Tell me, we haven't talked about your drinking in a while. What's that been like? Just bring it up, whatever they say, try a few reflections. And then you can move on but my bet is once you start talking about it, using these skills where people are not feeling like they have to justify why they drink or defend or get in an argument with you, you'll find that they go pretty smooth.